Good afternoon, everyone, and thank you for coming to what I think is a very important Grand Rounds. I think, as most of you know, both John and I really believe that a recovery-oriented system of care is imperative in order to help people on their journey of recovery. Coincidentally, I happened to get something today from Sherry Mead, who is one of the people who I'm sure Karen knows and knows quite well, who organized some peer support throughout her life. I want to read one of the things she says because I think it's really critical. I think the most significant differences between peer supports and clinical conversations are that they start with different assumptions. Too often, clinical conversations start with assessment for diagnosis. Before it begins, the conversation is already located in a pre-made deficit-based language. With peer support, there are theoretically no assumptions, just curiosity about what the experience meant to or for the other person, asking questions and sharing other meanings that open up the story rather than trying to categorize it. It's just, I wanted to use that to set the tone. But I also want to introduce our Recovery Leadership Academy and the individuals who are actually going to speak about this today. So let's see. We have, well, first we have Karen Kangas. Karen Kangas is the Director of Family and Recovery Affairs here. Karen is someone I've known for a very, very long time. She worked with me at the Department of Mental Health and Addictions. And when I describe her, I often say she is the grande dame of advocacy. She worked at Advocacy Unlimited. She knows all the advocates across the state. She's actually very well known nationally and has worked with SAMHSA on several grants. We have Tanya Cutler, who started with us at the IOL, working on an inpatient unit, and subsequently moved to NACHOG, worked on the adult unit for quite some time, and was very, very successful, and really helped NACHOG to understand the importance of having peer support individuals on the inpatient units. She then transferred over to work on the Recovery Leadership Academy with Karen. And I am struggling to see, Karen. Tell me who else is with you, sitting with you at that table.
Dantzler.
Got it. And?
Juan Torres.
Thank you. Thank you very much. So Juan Torres has been an RSS since 2018. He started at Rushford and then moved to the Department of Mental Health and Addiction Services. After 15 months with the state, he was able to utilize his case management experience to work as a case manager. He was promoted 6 months later to a higher level of case management and transferred to Whiting Forensic, where he really continues to advocate and support clients on every day, and has implemented recovery groups on the unit and help sessions for the population. And then we have William, who was the first recovery support specialist in our emergency departments. He was incredibly successful in helping, I think, reshape what goes on in the Purple Pod and increasing patient satisfaction. He worked very, very hard. He spent time sending out notes to individuals, sort of along the lines of our Caring Connection calls. And I think was so successful that we encouraged Erica to put somebody in recovery on all 3 shifts. So I'm going to stop there and invite the Recovery Leadership Group to start their conversation.
I'm actually going to start. I'm Karen Kangas, and I'm going to start with my necklace because this is my recovery necklace, and I want you to really think about this because it means a lot to me. So this guy up here, that's up here, and he's pretty strong, and he's pretty powerful, and he's pretty silver. He's Mr. Hope, and he's the recovery, and he can be his hope, her hope, they hope. It's hope. And to get to this point of being in hope, there's some steps here, and each one of these ropes is a rope that you can climb, because we talk about pathways to recovery. We're really clear about that there's a lot of ways of going. And so the first one I'm going to talk about, and these little climbers can go up, they can stay up, because I can make them stay up, or they can come up and down. And lots of times in our recovery, they do come up and down. First one I'm going to start with is medication, because we talk about that a lot. We talk about it in mental health and in addiction. So medication can be something that can be used initially. We can use it maybe sometimes. We can not use it, or we can kind of put it in the middle. Depends on where we see medication. Medication is administered by a psychiatrist, a doctor, an APRN, somebody that has the license to give medications. And again, we do it in mental health and addiction. So we'll look at that's one way of climbing up to recovery. And again, it could be way up here. You keep on doing it. Some of us use it for a lifetime. Some of us use it for part-time. It depends. So I'm not going to make any judgment about that, because that's not my role. Number two, this is a holistic role. And to be holistic, we look at, could we do some yoga? Could we do some qigong? Could we do some sound healing? And to me, holistic means we really pay attention to our nutrition. What do we put in our bodies? What is it that we put in our bodies? And I think about exercise. Do we exercise? What kind of exercise do we do? Do we do it all the time? And my exercise thing would be way at the top. It's always there, because every day I exercise. And I'm not sure about the nutrition, but I also looked at this as sleep. Sleep is a big thing to keep our bodies healthy. And for me, sleep is a real difficult time. So I'm always consciously, mine's way up there, because I always have to worry about it. And I also think about putting the COVID vaccine into this one, because we're really thinking about keeping our bodies healthy. And now we're looking at the flu vaccine. So all those things have something to do with recovery. So we can keep them up here, down here, depending on where we see them in our lives. Rope number 3 is we can go to a program. And there's lots of programs we can go to get help with recovery. We can go to therapy. Lots of people go to therapy and they stay forever. So it could be way up here. It could always be here. I know people that go to therapy for the rest of their whole lives. Some people go for a month, some go for 2 months, depending on where they're going to be. And so again, this person can climb, it can climb up, and it can climb down, because there are times when we need it more than other times. So we put it up and down. And we can also go to a CBT program, cognitive behavioral therapy. We could go to a DBT, dialectical therapy, behavioral therapy, LGBT program, which is very helpful, a rehab. We could go to a harm reduction, all those things where there's programs for us to attend that help our recovery. Again, we might attend them once. We might be always involved with them. We might be sometimes involved with them. Rope number 4 is what I would call the faith one. It's faith and spiritual. And so for lots of us, it's way at the top, and it's always there. We always think about our faith, our spiritual connection. We also think about this in terms of our connection to nature and connection to the world. And so it can always be way up there. Or it can come and go depending on how we really need and use it. And people, again, it goes with what they need in terms of what they're needing at that time or what they need to live. And number 5 that we always have to think about is we need a place to live. We need a place to live that is safe. It could be a home. It could be an apartment. It could be a mansion. Just someplace that we're really safe. We feel safe about it. But in that home, we need to do something. We can't just be idle. We're not going to stay in recovery very long if we don't have anything to do. And there's 2 things that I think are real important are, number 1, we need a job. We can have a job that's a volunteer job, or we can have a job that leads to a tremendous career in our lives. And another thing that we can do to get that job is education. We are always about education. And I always keep that one up really high, because I'm always learning. I don't know it all, and I certainly probably never will. And I'm really old, and I still need to learn all the time. And so education is real important. And the 6th rope I'm going to put up is the peer rope. And I think of peers as people in your life. And I also think of peers as I think of it as my family. my family were my support for a long time. And I think they were still living, they still would be. My daughter is still my support. So family is support, peers are support. I think of relationships. Who are relationships in our lives? What's our support network look like? It might look like a support group. It might not look like a support group. It depends on what we need. It's a network of people that help us. That our social network, it could be a very work network, someplace that helps us really keep that recovery. And again, that might be way up, that might just stay up there. And so all these things could stay up there. They could all be up there because for some of us, we used all of them, or we used some of them, or we used them when we needed them. And so they go up and down. That's why this necklace is so valuable to me, because it can go up and down, or it can just stay up here. But the goal is to get into be Mr. Hope or Miss Hope or Mrs. Hope or Dr. Hope or whoever Hope you want to be. Let's be Hope. And now I'd like to talk to you a little bit about our peer specialists. One of the things that we teach, and I've been doing this for like 12 years, teaching not only at Hartford Healthcare, but at Recovery University at IOL. And my three panelists, I'm really proud to say, all went to Recovery University. And they were all students of mine at one time, and now they're just really very special friends and colleagues. And so they're very valuable. But one of the things that we teach, and we teach it very consistently, we really make sure that they know there's values. There's values of what we do. There's ethics. We have some ethics that we have to live by. We have some principles, and we also have some boundaries. And we're really clear about these, and we teach these over and over again because we don't want to go over the boundaries. We don't want to lose our jobs. We don't want to be in any kind of difficulty with anything, with our clients, with our staff, with our peers. We want to be really transparent. So one of the first boundaries and things we think about is we don't discriminate. And I look at Pat Reamer and I think, it's not about stigma, it's about discrimination. It's definitely about discrimination. And today I have the honor of speaking with a African-American, a Native American, and a Latino person. Just think, so we really honor diversity. And you're going to hear from all of them in just a minute. One of the other things that we teach is choice. We really teach people to have some choice. You get a choice to what you want to do. You get a choice about how you're going to climb your rope. What rope are you going to climb, and what's going to be important to you? And another thing that we actually talk about is advocating. We have to advocate for things. They don't just come to us. We have to make sure we teach about self-advocacy, because we have to pay attention to how we can get what we need. And that means we have to learn about the laws. There are some laws, including the ADA. We need to know about them. We need to know how they apply and how we can teach others to know they apply. So they have a way out of wherever they get into, because we get ourselves into all kinds of conditions that we really would love to be out of. We have to know how to get out of those. So we need to know about advocacy, and we teach that thoroughly. We teach about dignity and respect. And we teach about confidentiality, how important that is to keep something very sacred. And we teach about those bonds. And I started my career at Fairfield Hills, which doesn't even exist. And yet I still hear from people that I knew 50 years ago, 40 years ago. And because I keep that bond so close, they still can call me, and my number has always been open. I don't have a private number. So it's and nobody's ever misused it, actually. I've always had people just call with tons of respect, or to tell me what they're doing, or to tell me what they might need. How can I help them? And so our dignity and respect is always with us. And our boundaries are really important to us. We kind of think of ourselves sometimes as professional friends. We're friends, but we're professional, because we're not going to get intimate. We're not going to date people, but we're going to go with people. We might go and have a cup of coffee somewhere. Best place, not in a hospital possibly, but let's go out to Friendly's. Let's go out to Starbucks and have a cup of coffee. And find out what's going on with people. I know for a year, I think I met 2 or 3 people that are now RSSs, and I met them almost every week for a cup of coffee. And we just talked over things. How can they be better at what they're doing, and how can I be better? I mean, it's always a mutual conversation, never one way. One of the other things that we teach people to do is how to share this recovery. We don't share everything, because everybody doesn't want to hear us talk forever. So we share the kinds of things that are important at the moment that are important. If somebody's having some difficulty with taking medication, for example, because that's always an issue, we might be able to say, hey, there's some ways you might want to think about doing that. Might think about it. Let's take it for today. And if it works, it works. Let's maybe a little longer. Let's talk about it. And so what are those side effects? Do we know those side effects? Can we find out about them? If we can't, we can certainly say to our RSS, could you go with us to a meeting and find out about those side effects? Because we need to know those. So we do share our journeys, but not the whole journey, unless we're asked to be the speaker for the day. One of the most important things that we do is we keep current. We know the best programs. We know what's happening today. We know that I think it's the Colts that are doing this whole thing on campaign on NBC. I saw it on NBC. I actually saw it on CNN as well and other channels. They have all kinds of people there that are talking about their recovery. And it's what amazing thing that was, because I remember years when nobody talked about recovery. And now we have Rob Lowe was talking about it. Snoop Dogg was talking about it. NFL players are talking about it. The coaches talking about it. They even have sneakers that you can buy that are discrimination sneakers. I tried to buy them, but they don't sell them. So maybe I have to make my own. But we have to pay attention to that media. What are they saying about us? What are they saying that's good about us? What are they saying that's not true? How do we change some of that media? And we can make that happen. So now I am going to let the panel speak. I think it's about time. And to my right, first of all, I'm going to ask all of them some different questions. The first one I'm going to ask them is to tell us, this whole audience, about what they do as an RSS. And the first person to speak is going to be William Dantzler. And William, I remember taking the course a few years ago, and he took his course at Recovery University, and it was in Avon, Connecticut. I remember distinctly, and I think at that point, I really enjoyed hearing him because he had started a support group and was ongoing with that, but also struggling a little bit. And I think the course and all the people certainly helped him create the job that he now has. So tell us about your job, William.
My job in the ED, I figure support the patient first and foremost, support the providers, the clinicians, the team, and getting the best outcome for our patients, their treatment, whether it be connecting them to services or connecting them to a program, whatever support I can do. I mean, if it's, go get a cup of coffee, whatever I can do to be of support so that patient has the best experience is what I try to do.
And I just know from knowing the whole thing that goes on in the emergency room that his staff, his teamwork, they really value William. They ask him, I know one of the doctors told me that they ask William to go see the client before they see him. Amazing that he has that kind of respect. And Tanya Cutler next. And Tonya and I worked together. We worked at IOL and Rushford, and I've certainly seen her at Natchog. And now she's working on Recovery Leadership Academy, and she's going to be working with our internships. And for those of you who don't know, but many of you may know, we have a $2.2 million HRSA grant. And so we're able to offer internships, and we're also able to offer scholarships. And so we now have a class that meets with us Tuesdays and Thursday nights. We have 60 people in our class right now from Connecticut, but we also have somebody from North Dakota and Massachusetts. So it's growing, and we're doing very well. So Tonya, tell me about what you have done, because you've done many things and still are.
So in my experience working inpatient at the IOL and Natchog, I met with people individually. I collaborated with the team. I also ran the recovery groups that were available. I attended probate hearings with individuals and did a lot of advocacy. In my time working outpatient at Rushford, my initial time with Rushford, I'd meet with individuals. I did groups and a lot of family support and family groups with Smart Recovery as well. I'd go to meetings with people when it was their first time. They hadn't had that experience and really were nervous about that. So I'd be able to do that with them. Now in my role as an RSS coordinator with the Academy, I'm helping teach the course with everybody, but I'm also providing some education and training and support for our interns throughout the network, which seems to be going quite well. It's an exciting time to be able to have this now, so they can have that in-person live experience going into the field. That can be really nerve-wracking, especially if you're the first RSS that somebody has had and they're not quite familiar with the role. So that has been my experience, what I'm doing now.
And then the next person that I'm going to introduce is Juan Torres, and Juan did his recovery university training in Norwich, Connecticut.
Norwalk.
Norwalk. I'm sorry, I
remember that
get
drive.
Norwalk way down south, I know. We had an exciting class then, actually. We had some really outstanding people who are still in the field working. And one, it's funny because he's just moved. Every time he calls me periodically, and every time he seems to call me, he's moving to another place. And I think that he has a lot of value, but I know that he also speaks Spanish, and boy, does that a clue that helps people a lot. So tell us about your role right now, or the roles you had. Go ahead.
Well, when I originally started at Rushford, even though I was hired as an RSS, the CSP case management team actually was required to have an RSS on their team. So I pretty much started off as a case manager immediately, but I was assigned the clients that that really needed extra help when it came to addiction and alcoholism, especially those who were wrapped up in the justice system, court dates, probation, things like that, DCF. It was a really good experience for me, but when I transferred over to Norwich, which is Southeastern Mental Health, I was actually able to utilize my RSS role, and it was an amazing experience. The biggest problem in SMA, which is what Southeastern Mental Health is called, the biggest problem is that the recovery environment wasn't really focused on like the other 22 and a half hours that our clients have to live, besides the hour to an hour and a half that they're either in a group or they're in a therapy session. Like, that's a long time to fill when you're so used to living a different type of lifestyle. So I was pretty much given free rein to just organize different events at the facility, different groups. We created an entire community that was based around our clients' needs. We didn't even call them clients; we called them community members. We had a recovery, advisory committee, the RAC committee, and I was honored to be able to chair that committee. That was kind of like a bridge between the population and management as far as concerns. We went to recovery meetings, recovery events, pig roasts. We just pretty much worked on educating our population on how to live a different life, because that's like the main focus when somebody walks in the door of a facility, right? It's not necessarily, I want to get therapy, I want to get on medication, I want to do this. It's like, I want to stay clean, but what do I do the rest of the time, right? Because I can't run the streets and stay clean. I can't hang out with the same people and stay clean. I can't be the same person. That's the scary part, right? I can't be the person I am and stay clean. There's a good chance I'm going to, return back to that lifestyle. So, the management at SMA was really, they were just awesome. They were, encouraging and supportive, open-minded, management, including the CEO. The CEO of SMA really was just on board with allowing us to do anything we can do to support our community, and to help them kind of transition from, active addiction, active alcoholism, active mental illness into a life of recovery. So it was a really awesome experience there. And, because of some life things, I had to transfer back to Central Connecticut. So, I transferred over to Whiting, and right now I'm what they call an MHA2 lead. So I'm a supervisor of on a unit of 5 MHA1s. And again, a blessing for me anyway, is that being in school and having to do an internship, my unit director allowed me to do my internship on my unit. And the way we did it was we created recovery groups. And so we have 7 weekly groups that we run on our unit. Because of COVID, we're a little bit restricted as far as anything outdoors or, involving the outside community, but we're working towards that. And again, very supportive CEO. I think that's been the most important part of my journey as an RSS, is that the clinical teams, the case management teams, the management of the facilities, they were all on board as far as creating just a really special thing. They wanted to do something different, and they knew that it was vital for their clients to be successful once they left the facility or once they transitioned to a different area. So they were on board 150%, and it made it so easy and that much more special. So.
Wow. And you kind of answered a couple other questions we had here, but thank you. Next one I was going to look at is, when you think of the value that you have as an RSS, can you describe it, kind of how the value is to the person who's getting there, who's getting the care, and also to the team, and also to recovery? How does it manifest itself to really getting people to get well again? William.
I think what I do resonates to the patient best because it educates them. I think what we offer in the ED through recovery support, we kind of get involved in kind of explaining some of the things as a clinician or a provider. You can sometimes see what's going on with the patient, but oftentimes when I'm explaining things to a patient, we're explaining what's going on in present time. So we're actually able to pinpoint some of the things that are going on with the patient. And I just think the education as a whole, and having them see a person in active recovery and see how it looks, because oftentimes in recovery, we don't know how recovery looks. So being able to give the patient that visual and giving them that education is helpful. For the provider, it gives them valuable time to focus on getting the best treatment plan together, while I could be sitting with the patient trying to figure out their housing situation, if that's an obstacle, or continued care after treatment, different stuff like that. Or whether it be, helping this person, find out what they want to do with their time after. So for the clinician, for the provider, it helps a lot. For recovery as a whole, just the consistency and the discipline, it leaves a map for those coming behind me to follow, so to speak. So I think that's.
So you would say you're really a valuable member of the team, or you feel like you are.
I feel like a member of the team. I feel like it's a value, but I feel like I work with a lot of very strong people, and I feel honored to be a part of that and to be accepted. So I do feel like a part of the team, and I feel accepted as a part of the team. But I just feel everyone kind of carries their own weight. So
Very, very good. Thank you. Tanya?
So I think for me, the biggest value of that RSS role with people is the person-centered care and support, and helping them find their voice and share their voice that is too often silenced in their lives. To be able to support them in that and to be heard and be part of that process in the decisions and what they feel might be right or best for themselves, and just being able to support them through that. Whether it's being with them and me being silent while they're expressing their own thoughts and opinions about things, or if I'm there encouraging them, or being that voice for them, if that's what they've requested. So I think it's more of that patient or person-centered care and support.
And how do you feel as a member of the team? Do you feel like you're supported, you're valuable?
Yes. Early on, because it was a new role and I was new at that, there were some challenges that were, kind of difficult, right? Something else that might be a challenge with feeling like part of that team is when there's a lot of staffing changes and then you have new people coming in who are trying to figure out their role and where they're at as part of the team. And then they're learning what we do and how to collaborate together. And that can be quite challenging. But I had gotten to a point in my RSS roles where I very much felt included as part of the team. And people coming to me and asking me to provide education in terms of recovery-oriented language and that kind of stuff, asking for my thoughts and feedback in terms of where somebody's at or any suggestions that are outside of the box of just typical treatment. That's something that we bring to the table as well, having that lived experience, as we can think outside of the box.
When you talk about recovery language, which I think is so important, what words are really harmful for us that I think all of us actually, and of course, the one I think of the most is the label. Oh my goodness, oh, to hear that label, oh, it's bad enough to hear crazy, but to hear the label, always, you know, that those schizophrenics, oh my God, what's wrong with them? What do you mean, what's wrong with what's wrong with people that are having some difficulty, or is it their label? What do you think about language?
I think
the language is hurt.
So it does, it does, because often that's what people identify with, right? It's, you know, this is who I am, this is who everyone believes me to be, whether it's an addict or an alcoholic or a frequent flyer, you know, that's something that goes around quite often. You know, I'm somebody that has had multiple experiences because I've gone through multiple stuff in my life. And if I need help multiple times, you know, but being labeled as a frequent flyer means that all those times I've attempted to try again and get back out there is a bad thing, when it's not. It's a good thing because I still try, you know.
It's funny because frequent flyer to me right now would be, oh, good, I get to go on this vacation and that vacation. And yet I know I was a frequent flyer too. And boy, here she comes again. Oh my God. And I remember one time people were just so annoyed at me. The doctor actually threw some medication at me. And I thought, wow, you have the nerve to do that. But it is a very, very hard thing to live with. And I've heard it said a lot about people. Juan, what's your experience in terms of how you see your value as for clients and team and yourself?
I kind of relate as far as how I see the value of an RSS. And I've been asked this a lot of times before because, like I said, some of my coworkers were really interested in what we do and like what our mission was. And I kind of explained it as if you could imagine yourself walking in to see a doctor, your right arm's in a cast and you're in pain. And you walk into the office and a doctor has his right arm in a cast and he's in pain just as you walk in. It's like a total comfort zone, you know, and for whatever reason, people just kind of know. You know, what was the second part of the question as far as the value that we add?
I just think also, I think you've kind of brought this up before, that you really feel like you're a valuable member of the team because you've really gotten a lot of support, it sounds like, from the top of what I guess the CEOs and all kinds of things. So you feel like you're a valuable member of the team? Oh
yeah, definitely. And I think, I mean, for myself, I know that I bring a different perspective to the population that we work with. You know, I work with a lot of individuals who've been there for a lot of years, and the labels are somewhat normal. You know, for a long time, it was only actually recently that the people on my unit even found out that I was, you know, someone in recovery, and I heard the labels all the time about other people, and you know, so
you kept quiet.
Well, I mean, you know, you're new on a unit, you don't want to, you know, cause anything, but it let me know that stigma is still there, right? So the way I fight stigma, and I do it in my own way, is that I set an example, you know. So you know, I just believe again that I add value to the team, that we're respected. Now that they know that I'm in recovery, you know, the conversations are a little bit less. But that's a good thing because it gives me more time to work with the population and to do a lot more one-on-ones. So yeah.
So you're actually always role modeling recovery in a way.
Definitely.
So how you treat somebody, how you introduce them, how you make them feel, you're modeling recovery.
Yeah, I think an important part too is that the RSS community has grown so much that, I've done trainings in the last 3 years that I've met people in those trainings, and those are now colleagues of mine. They are now coworkers of mine. We still keep in touch with each other. I'm actually, looking into a different position that would bring me closer to my RSS role, and that's in the advocacy department. So we're working towards some things.
And when you look at recovery, are you just seeing those of us that identify as recovered, or do you see clinicians in recovery, doctors in recovery?
Well, I mean, I know
Oh,
personally, I know a lot of,
we all know, right?
yes, people from all different backgrounds, therapists, social workers, nurses, yeah, it definitely doesn't discriminate.
It doesn't discriminate. You're absolutely right. And yet I think we have the courage to talk about it, because it needs to be talked about. And we say all the time in our course, don't be ashamed of it. Wear it with a badge of honor. It's an honor to be in recovery. It's an honor. And so the next thing that I know you've kind of touched on a little bit, if you have anything else to add to it, sometimes when we go into a unit and we're seen as this recovering person, kind of like there's these barriers. Can you think of some barriers that you've had to overcome?
You asking me?
Yeah, okay, go ahead, Juan.
Well, I mean, at first there, of course, when you're working in a new place or on a new unit, there's always that stigma when you first walk in. They're like, here's a recovery guy. He's going to do something that supposedly we can't do. He's going to work a miracle that we've been failing at, supposedly, right? So, but I think my experience has been that once, because just like any other position, in life, you have to prove yourself. Once the people I work with actually see the value that we add, see the kind of like the unification that we bring to the table, right? Because we are really, in a lot of ways, a bridge between our population and our clinicians and our case management team. And that's what I was used for most of my time in SMA in Norwich. And it created that sense of community where there was the trust grew, and people felt more comfortable really talking about what was going on and what we could do to improve the situation. So.
And Tanya, how about your barriers? I remember one of Tanya's barriers. She was on a unit and she didn't have a place to be. I mean, a place to sit. I mean, you could sit in a chair, but it didn't belong to you. I mean, you think about what you go to a job, usually you have some place that's yours.
Yeah.
I don't care if it's a corner in someplace, but you have something that's yours.
And then also all my group materials and all the resources I was collecting for everybody, I kept that in my little staff locker. So I didn't have personal stuff in there, but every time I go in to prepare for a group or grab resources, I'm having to pull it all out and then get back organized again, and you make it work. I would say another barrier is just that trust component that you had just mentioned as well. I know early on, especially with it being a new role for other people that I was working with, them trusting in my boundaries, trusting in that confidentiality that we also bring in this role. Epic was a big one too, because when I started, RSSs did not have access to Epic. So we had a lot of conversations about what information for an individual should we be allowed to look at, what should we be allowed to add into that. So it took a lot of advocacy for us to now be able to document like everybody else does on the team. But it was quite a barrier. So we've come a long way in that.
Yes. How about you,
Nice.
William?
Fortunately, I don't really have many barriers. I'm thankful to Erica Mora and Dr. Pepper and everyone at the pod, but they kind of made sure that I take care of myself. They gave me lots of advice to make sure that I take care of myself. But if I had to think of a barrier, it would be some of the resources aren't intimately available, and it's harder to get some of the patients where we want them to go. But as a recovery specialist, I have been accommodated pretty well. Thank you.
Okay, one of the things that you just added that I think that I didn't even have down here is how about our self-care? Because I think that's really important, because you're going on a unit where you yourself may have been, maybe not that exact unit, but it certainly reminds you of the unit you've been there. And so how do we keep concerned about our own care? What do we do? I can tell you, everybody knows this, I ride my bike 40 miles a day. Stationary, by the way, stationary. I go up to, my daughter's running in the Chicago Marathon, but not me. But I run stationary, but I also have, and I can really say this with absolute, I don't know, inspiration, admiration. I have a supervisor that absolutely just cares. I can't tell you, I can go to her with almost any kind of concern and any kind of thing that we might need that's not doing very well. And she always listens. And I can email her at night, and even though I even get emails late at night and weekends, and not that I try to overuse it, but she's just somebody that absolutely helps my day every day. And I don't know what I'm going to do without her, but that's my own, but I'll have to find some self-care around that too. Anybody else, what do you do for self-care, William?
I do a variety of things. I generally try to get 3 hours in on my bike at various times of the day. I journal, which we
Yeah,
encourage people to do in Purple Pot often. I sit for, just silent time, no looking at my watch, my phone, different things like that. I basically follow the same 4 tools that we encourage the patients to do in Purple Pod. That's what I do for myself. And I think that's what makes it most effective, because they're actually able to see it in person. So I think that's important.
Tanya, how about your self-care?
So aside from continuing with therapy, I keep doing the work, right? I enjoyed that work aspect of my recovery when I was in treatment. So I've continued with that, which is also stuff that I share with individuals that I'm supporting. So even in a group topic or an exercise that I'm doing, I draw from my own experience. I get creative with that. But I do the work and I introduce it to people. So for now in the Recovery Leadership Academy, I'm watching the videos, I'm doing the homework, I'm learning a lot. When I was at the IOL, something that was very helpful in terms of my own self-care and those core values that I didn't know were there was when I took Dr. Toland's CBT training course to get certified for staff. And I use that information as it applied, I use my personal information as it applied to all the work that we were doing in the course. And so it benefited me in my recovery and in my life and overcoming some of those, really dark core values. But I could then share it with other people and what was challenging about that to get through. But then what did I get out of that as a result too? I think modeling that example, and these are things that have worked for me, and then supporting others and sharing that with them in case it would be helpful for them too.
Juan, what do you do for self-care?
I do a little bit of everything. I'm still active, obviously, in my personal recovery process, so self-help groups, working with gentlemen just coming into recovery, mentoring, if you want to call that, sponsorship. But lately what I've been doing, I'm also a father, so obviously that takes up a lot of time. Lately what I've been doing, this is kind of a plug for anybody out there who's listening. So there's an organization, it's a national nonprofit. It's called the Phoenix. Their website is thephoenix.org. They are in 22 states, and they are actually just recently came to Connecticut. So a friend of mine is the state organizer, and I've just signed up to be a volunteer person with that nonprofit. We have about 4 events going on every week in the state of Connecticut. So it's really good as we expand for anyone who might need to refer a client to some of these little events. But we actually just got approved for a clubhouse per se in Portland, which is right next to the halfway house that you guys have. And I'm looking forward to doing a presentation over there at Stonehaven within the next couple of weeks, so we can explain to them what we do at the Phoenix. It's basically a free resource for anyone in recovery, as long as they have 48 hours or more, clean or sober, to come and practice self-wellness. We're going to be doing holistic care, basic exercises, yoga. I know Meriden is going to have a kickboxing class starting soon. And this is all activities run by people in recovery for people in recovery.
And I
like
know
said,
somebody that went last night to Sound Healing at the Phoenix.
there you go. the
I see
Phoenix.
she called me. so-
Wednesday nights, yes.
And again, and she's in recovery, she's concerned about her mental health right now, and so it's healthy for all, because you don't have to be clean and sober, but you have to be, you want to go, right?
Yes, yes.
Okay, and then probably the last thing, and then we'll open it up to any kind of questions. If you had, there are a lot of people in the hopefully on our course that are listening that may just be willing to have a RSS come into their agency or into their group. Is there anything that you'd get, any kind of advice that you'd want to give them that would help them make an RSS feel comfortable?
I would say just trust your recovery specialist to be themselves. I'm always me, always. But no, I just think trusting. Like that's probably something I appreciate the most. Just being respected for what I do, but I'm not expected to be something that I'm not. I don't have to make up different things. I could just present as I am and be accepted for that. So I just think accepting like that individual for who they are is very important.
How about you, Tanya, anything?
I would say being open to the experience, being open to learning from each other, teaching each other, supporting each other, and being more curious, not so judgmental, but just being open to it can go a long way.
I would say be open-minded and be excited. Like you're talking to someone and you're going to be working with someone who literally has taken the path that you want the person you're working with to take as far as recovery goes. And it's a huge resource for, just anything in the community, anything that you might want to get involved with. It's actually a really special role. This role changes a lot of lives.
Well, and I was going to ask you also, how do you think about doing this? And I think about myself only because I can just say to you that at my age, I could have retired. Like I did retire more than once. In fact, somebody said, if I have to write you one more retirement card, I'm not going to do it. And she didn't have to do it because I think I'm probably going to be here until I can't be here. And I make sure I do everything I can to be here because I think it's absolutely inspirational to see people change and get well and get on with their lives and find their life and say, oh my gosh, it's not the end of the life. And I know now we're going to start looking at working with some young kids and just to say to them, this isn't over for you. And the fact that you may not even want to drink again, wow, that's okay. There's lots of us that do what we do. And it's an outstanding job. I wouldn't trade it for anything. I know one time I was called the principal of a school, and the next year I was called the person with the keys. And I love being the person with the keys. I still like the keys though too, to get out. William, what about you? What makes you feel really good about this job?
I go home with a sense that my colleagues and I have done something for someone that was difficult for them. I go home with the truth of knowing that everything that I've expressed to my patients and encouraged them to do, I'm going home to do the exact same thing. And I just think that that's been the most helpful thing, just feeling like I'm not doing something for people, but I feel like I'm just being a part of everything with all people. It's kind of.
Tanya?
I think for me, it's the sharing, learning, and growing together. I get to share the things that I've experienced and what I've learned, but I learn a lot from the other people that I'm providing support for as well. And I know there's been several times in group when somebody announced what, their amount of sobriety time that they've had or time in recovery, and then everyone applies. But then there's been those times when they've asked me when they realize, oh, you're in recovery as well. And then and then they applaud for you too. And it just makes you feel like you're amongst your own kind, people who understand and that are also excited that you're there. But I also enjoy that aspect of this role in that it reinforces my own recovery every moment that I'm in this role. So I like the two-way street and the mutuality with that. I like that a
You
lot.
can answer the next question in Spanish if you want to, Juan.
No, it's okay.
Well, there's lots of people that
That's
speak
all right.
Spanish. Go ahead. No, I'm just teasing. Go ahead.
Can you repeat the question for me? I'm sorry.
No, just what do you really like about this role? I know you've changed it, you renamed it. It's kind of been renamed for you because now you're the MHA lead and that's a very good position, but you actually always remain kind of a part of a recovery support specialist, right? Even though you're changing roles, because that's not my title either, but I still think of myself as doing the same thing in a way.
Yeah, I mean, I know for myself, I will utilize the RSS role for the rest of my life. Even, I'm in school for social work.
Ooh.
Even if, God willing, if that pans out down the road, I'll still be an RSS because what it's done for me, it has kind of like allowed me to be myself within the role, to just be like really encouraging and exciting about recovery and to try to kind of transfer that energy into the population that I work with. I love talking with people in my unit, and I mean, it's sad, but I love it at the same time, just hearing them share with me that like I'm the first person in all the years that they've been there that has actually like taken the time to listen to them, to give them encouragement for the future, and to just let them know that recovery is possible. I mean, like I said before, the RSS role is life-changing.
Thank you. So I think we're open to any questions that you might have from the audience.
Folks can just unmute themselves or put a question or a comment in the chat. We have one comment in the chat so far talking about I think the need for authenticity, trust that we are an essential part of the team and we too add value with our own unique perspective based on our lived experiences, including being educated and professional with one shared goal, providing the best collaborative treatment for our clients. Dr. Santo-Pietro has a question. If you want to just unmute. Thank you, Dr. Santo-Pietro.
Can you hear me?
Yes.
Yeah. So I can see you guys. There's actually, I don't even know if I have a question. There's so much I want to say. I'll try to keep it brief. This is extraordinary in so many ways. I'm looking at you guys. You're on the grounds of the Institute of Living, and I just imagine all of the people looking back, 200 years, looking at this moment, and it's kind of inevitable. Like this is a result of all of the work that's gone on in our profession to get you in this room talking to us this way. It's just an extraordinary moment for us to hear from you and dialogue with you. So that's number one. Number two, this would not have happened were it not for Pat Reamer. And I think many of you know she's recently announced that she thinks she's retiring, which we're going to be in denial about.
I know.
Or try to fight to get her to stay connected with us in one way or another. But it's also part of her legacy that we're having this conversation with you, and I want to give her credit for that. So here, do you guys remember when there used to be suitcases that didn't have wheels on them? Somebody talked to me about this once. They said, you remember when there were suitcases they didn't have wheels? Like some of us are old enough to remember that. There actually were suitcases that didn't have wheels.
Yeah.
And you had to carry them, and then someone had the idea, let's put wheels on the suitcase. And if you remember in the beginning, they were kind of clunky and you had the strap and you had to pull the two wheels and stuff. And now, can you even imagine a day when there won't be wheels on suitcases? You can't even imagine it, right? So this is what you guys are. This is what recovery is. And when I say you guys, it's us, right? Like the point that we're making is it's not us and you, but what you are speaking to, that you have the courage to speak to. This is like wheels on a suitcase. It's not going back. It makes so much sense. It's what the work is about. So somebody put the word authenticity in there, and you bring authenticity. If you took two treatment centers, treatment center A has an authenticity rating of 2 out of 10. Treatment center B has an authenticity rating of 9.5 out of 10. And this is my, study I'm doing in my head, and you compared the treatment, where people are going to get better. They're going to get better where there's authenticity. So you raise our authenticity game. What Juan said about the cast, the arm and the cast, you break down barriers. For some reason, you know, people don't have a problem showing that they have an arm and a cast. Oh, I feel like you do. Or even if they don't have a broken arm, somebody walks in with a broken arm, they can empathize with it. It's more difficult when we're dealing with mental struggles and mental illness, and you're breaking down those barriers. And then lastly, I had this thought as you were talking. So you guys are starting off, and when I talk with recovery support specialists, you guys are starting off where it has taken me a whole career to get to, right? It took me a whole career to realize it's okay to give people hope. I was, you know, part of my training was, oh, you're going to try to give somebody hope. That's not your job. You know, your job is to diagnose and to treat with medications. And, you know, you don't want to get into wish fulfillment. That's what the word was for it. And then, you know, so it's taken me a career, you know, to break down the barriers that you guys start with and continue to urge us to follow in your footsteps. So I just mostly wanted to say that stuff, wanted to thank you, and I don't even have a question. Sorry.
Thank you.
Thank you. We have a question from Dr. Marissa Sisley Rogers. She says, thank you so much for all that you've shared. Very grateful to hear about all that you and the incredible value work you do. I was wondering if you could share any particular feedback from those you've helped that especially highlights why the role of RSS is so critically valuable and needed.
That's easy. We'd like to go ahead.
Well, there was a situation when I was working with a patient, and this patient had been through a lot of different traumatic experiences, and we encourage people to practice tools. And when giving this individual these tools, the individual really felt as though we had restored hope and gave them some kind of foundation, something to start. And that like really resonated with me, and it was something that meant a lot. And above all things, that probably means the most, just knowing that someone who felt lost and felt drifting and wasn't connected found something in purple that really changed the way they see life.
And to me, it was probably like, I think about it being my memorial, although I'm not dying yet. But I went to the opiate overdose celebration in New Britain, and there were like 7 speakers or maybe 9 speakers. 7 of them were in graduates of Recovery University. And I was like, oh my gosh, now and one of them said, I'm going to run for office. And I'm like, ooh, and it was just so exciting. And they came up and they were grabbing me and hugging me. And I thought, wow, what a connection we made to people. And for them it was their program. Totally their program. And it was so exciting to be at Walnut Park in New Britain. And I think that's the kind of thing. And then I also got an email from somebody that said, you know, if it hadn't been for your help all these years, I would never be where I am today. And today she's running a really neat program in our state. And so you just feel really good about and it's by individual by individual. It's not, you don't change the whole world. You change one person at a time, if you can. And they change you too. Go ahead. Anybody else?
She is running for office, by the way. Yeah, she is. I'm from New Britain. So. Yeah, I'm kind of just all over the place with you know, thinking of all kinds of different things. But as far as like one specific case that we've worked with, and I'll keep it as short as possible. So you know, CVH has had a long history of you know, for years they provided educational services for the population, and then for years those services were cut off after a certain incident. And you know, arriving at the unit, there was one person specifically who was just very motivating, he was just an RSS, and I knew it right when I met him. You know, for being on that unit for that amount of time and being as enthusiastic and caring and supportive of everyone else on that unit, I just knew that he was an RSS. And as much as he wanted me to help him gain some training to be a fitness instructor because he's ready to transition, we started fighting for him to receive the RSS training online, and he did, and he was successful. He's a certified recovery support specialist now. He'll be transitioning into the community in another few months, but to see the change in him and to see just, the change in the whole community that I work on, the whole unit now, I mean, and it's ongoing. So now we just had a second class and 2 other community members were able to take the certification course, and it's going to continue. To add to the workforce. So I'm really excited about that, and it's a big thing.
I think in our, because of the 2 Johns on our course, we're going to actually go into the prison population. Because you think about where are people with mental health and addictions housed, and most of them are in our prisons across the country. And to be able to go into prison and present a course and say, here's a course, and when you get out, here's possibly a job for you. That would be a great thing to do. So we're really looking at reentry, and we have a lot of our 2 Johns are really involved in this process, and we're gonna get there. We're gonna get into those prisons and say, wait a minute, you get out, you have something, you can hold on to something.
I just wanted to speak to that point. I mean, I know you said you're working in Whiting Forensic, but for most of us, the idea that somebody in Whiting Forensic could take a course like this and then transition right into a job, that is amazing to me. It is different than our hospitals, and people do stay there for a long time. And at least in my experience, I saw a lot of hopelessness. So having that take place and having you advocate for that is just, music to my ears.
Thank you.
We have a comment from Eben Lieberman, one of our ED clinicians.
Hi, yes. So I'm normally in the emergency department. Today I'm over in the assessment center. So, I've had the ability to watch and see, William's work with patients there, to a lesser degree, John as well. And I think, one of the big challenges kind of having to do with some of those stereotypes that you guys had brought up is there are expectations both from the patients and from, your coworkers when you're stepping into the situations. Both patients looking at you, expecting you to be the most authentic person that they talk to out of everyone that they meet there, from staff members who are expecting you to be able to kind of get results that no one else can, or maybe form a connection that no one else can. And what I see with you guys, and William, I see this every day with you, is that you are able to walk this really fine line where not only do you find a way to form those connections, but you do it in a way where it's against those stereotypes of, you're going to set yourself up to be the person who can help the patient differently than everyone else. The help is going to be through me. You actually do it in a way where you reinforce the structure of the system, and everything happening in the emergency department, which is along this very sort of rigid, kind of sequence of events where you're either going to be admitted or discharged. And so you are truly masterful at building the connection, giving people the opportunity to stay connected to you, but also reinforcing this is the system that you're in. This is what the help is right now. These are the steps that are within your control. This is what's outside of your control. And I just really appreciate that about what you guys do in the emergency department. So I just wanted to give that feedback.
Thank you. Thank you.
We have a couple of just comments in the chat. SK Daily says, I've never been more grateful than I am right now to be such a part of a wonderful movement. I feel pride beyond belief to be working with the most wonderful people on earth, and even more so to be working within the team I currently work. You all look fantastic up there, and what you have said has been so inspirational. Thank you, my friends. They also go on to say, I agree with that, Karen. I would not be where I am if it were not for you. Camelia says, I've personally been thanked for being supportive by listening, validating, bringing different perspective, inspiring, bringing hope, motivating clients, and advocating for them. I'm grateful for the opportunity and not to only be received, but appreciated. I am humbled and grateful for this opportunity. We have time for maybe one more question or comment. I think I got through everything that I saw on my chat.
I wanted to say one thing.
Please.
For me, working in the emergency department, I kind of see my colleagues as my new peers in a way, because they're getting an opportunity to learn hands-on with life experience with someone who I'm hypomanic bipolar. They're getting to see and live that experience. I'm getting to learn from them. So I just believe that it's a full circle peer support, for everyone involved when you're working with recovery specialists. So I really think that's important.
To me, this is John. I mean, that's William. That's sort of like an extension of Juan's metaphor of the cast, or the sling, because so you're sitting there and you actually have your arm in a sling. The person that's coming in actually doesn't have their arm in a sling yet. Their arm's still dangling out there. And part of the reason I think it's so effective to have recovery support specialists is that these people walking in who are suffering can see their own recovery. I think you've already said this, in your presentation. I guess one question I would have for you, because this is a moment in time. Thankfully, we're recording it, and we're doing amazing work building the infrastructure you all have built to educate and train and find roles for RSSs. So that's excellent. But in terms of this talk is about bringing that learning to the rest of us, right? So what are the other ways we can do that? Because this is a moment in time. We don't have grand rounds we can't do it every week, or maybe we should. I mean, what are some on recovery, and recovery support specialists? They're the people that we're hearing from that work with you and see you, and they learn that way, right? But do you have ideas about other ways we can really get the culture permeated in a sort of in recovery?
I just think that some of the meetings that I go to, which are administrative meetings, I sometimes feel very much like when we're talking about data and we're talking about statistics and we're talking about restraint, all kinds of things. I always think that we should always add with, and we're going to get this right because we're going to increase that recovery. We're going to increase that wellness. We sometimes forget that. We think we're going to talk about money in a whole different range. We're really talking about money to help people get well. I mean, we have to bring that in all the time, and we don't always bring it in. It seems like it's kind of isolated, and we're not isolated. We're really about making everything about, let's get people well. This is about wellness. This is about getting people back their lives. We're giving them back a choice to live a life, not to live a life that is always filled with pain. And certainly there are some painful times, but I just think of the ways sometimes that we have really in all programs actually have really increased some of this, as we have really valued the people. We've really made them feel important when they come in. We know their names. We say hello to them. And I can think of the days when I honestly, none of that happened to me. And it was really, really discouraging to go back and forth to those hospitals, because I don't know why I was even there. I don't know that I got much out of it. And I don't think I put much money into it either, actually. So I think it's really great that we're really recognizing people for people and recognizing wellness. Go ahead. Anybody else?
Yeah, in some my experience with this thing, John, to answer your question, that has been helpful in either integrating the role, opportunities to collaborate have been, I think somebody just put this in the chat too, is having us talk or pre-recorded or something with the new hires, being able to meet with them. When I was at Rushford and they do their orientation, Karen and I would go in and we talk about the role. We talked about recovery. When I was on the unit, I would get scheduled to meet with the new hires, like the therapist or the doctors, to be able to talk about the role and offer opportunities for us to collaborate. That was very helpful. Also, having RSSs join all these committees that are out there, get that lived experience, let people learn what it's like to collaborate and learn more about the role. So I do do a lot of committees, so that's been a very helpful thing. Having the RSSs attend department meetings for other departments, so the therapists, the doctors, nursing. These are opportunities for us to learn and to collaborate. But when we do that in these meetings, or even in
I just tried to,
lean huddles, that's opportunities there too.
Yeah, and I could not end this whole thing without saying thank you to Pat Reamer. I can just remember, and you think about why we have our SSs at Demas and at Hartford Healthcare, it's actually because of Pat Reamer. And I know when we were at Demas, she wouldn't sign a contract. You didn't get a contract signed if you didn't have an RSS on team. And my gosh, wow, that was quite, that there's nothing like putting that in writing that says you better do this. And there's a reason. She didn't do it to be mean, and she didn't displace people. She just put people that were retired, let's replace them with people that are in recovery. Why not make it a big, huge thing? And so all of a sudden we don't have to talk about it because everybody's talking. We're all kind of a little bit in recovery anyway. Actually, through this pandemic, I've met more people that think about recovery than anything. You see it all the time. So thank you, Pat Reamer, for really leading the way and making sure that these positions are even there, both in Demas and in Hartford Healthcare.
As I near my retirement date, this has probably been one of the best outcomes that I could have ever imagined. I really do think people in recovery bring an enormous asset to our teams and really to people who are seeking recovery. And it's been a journey, Karen, right? We've been doing this a long time, but to have this sort of be the culmination is really very moving for me. So thank you.
Thank you.
And with that, I will let you all continue with your day. Juan, Tanya, William, Karen, thank you so much. It was truly wonderful to spend time with you today. Thank you.
Thank you, everybody.